How did you emotionally accept your need for transplant? What helped you make up your mind?
Well, I was getting sicker. I was diagnosed with IPF in '07, and I was getting sicker, and I was referred to UCSF by my physician at Kaiser, and he gave me a window of time. He says, you have 6 months to 6 years or a transplant. So my wife and I started looking into the transplant, and then we came here and started the process. I didn't have any problem with it at all. For some reason, after I started coming here, I was very confident in the people that I made, the doctors and the support groups. And for some reason, it just didn't bother me. I felt very comfortable and confident that everything would be done very, very professionally here.
Well, I wasn't breathing too well, so it wasn't hard to make up your mind whether you wanted to get a lung. The option was there. And so it was easy to make up my mind. Breathing was good.
One of the challenges of a transplant is emotionally being able to decide how it's going to impact you. There are so many unknowns. So in my case, I had alpha-1 antitrypsin deficiency, and I was deteriorating very rapidly. So a transplant was my only recourse other than a slow death. So for me, it was a very simple decision to have a transplant.
I was initially caught off guard that it was that severe, but emotionally I knew that if I wanted to continue living, that this was something I had to give serious thought to. I called a family meeting. First I spoke with my daughters, and then we got together with the rest of the family to get their input. And they all agreed that if I was brave enough to step up to do this, that they would support it.
You know, the first time I met the pulmonologist here at UCSF, he pulled out a chart that showed the life expectancy of a person who had the pulmonary pressure that I had. And that life expectancy was very, very short. And the solution to this problem was lung transplant. So to me, it was, well, this is what I'll do.
Emotionally, I was not open to transplant. Everyone that I had seen who'd been transplanted, they were struggling. They were in wheelchairs or on oxygen, and I just felt like it wasn't something that I was willing to do. And it took me a long time to really come to terms with the fact that I was going to have one. The biggest deciding factor for me in finally choosing to have a transplant was simply that I was stuck in a hospital bed. I was actually admitted to the hospital and told that I would not be able to leave without a transplant. And that became a very good motivating factor for choosing it, because that just felt like a jail cell to me, and I was willing to do anything to get out of there.
I think initially I was kind of leaning away from it because I wanted to see with my condition if I would respond to medication. But I guess that wasn't really so much emotional response. By the time I realized I needed a transplant, I was all for it. I feel like the quality of life I had at that point was very, very much worth the risk. At the time, I was hooked on oxygen machines, taking a lot of painful medications, barely able to move, barely able to walk, losing weight drastically. Just a whole myriad of issues with my medical condition at that time. It wasn't the life I had. A lot of things that I was working on, doing a PhD and so forth and so on, I had to stop a lot of that. I had to stop working the way I used to, and I had to change a whole lot of different things. I could have lived like that, but if there was an option, I didn't want to live like that. So the risk was worth it to me.
Emotionally, when I was told I had idiopathic pulmonary fibrosis, I was devastated because my mother died in 2004 from idiopathic pulmonary fibrosis. She didn't get much mourning. She was diagnosed in December of 2002. My father died in June of 2003, and my mother died in March of 2004. So it was a rough time, and I just remembered the emotions of going through that. So I was diagnosed in 2007. My doctor told me that diagnosis to death could be as much as 5 years and as little as 2. That they try to pay attention to people with lung conditions very closely. And so I felt confident that my doctor had caught it soon enough, but I was also encouraged knowing that I had an option of having a lung transplant and not having to die. So emotionally, it was rough. How did I prepare for it? I would say that I just reminded myself that I had a lot to live for, and I tried to put it behind me. I tried to put my fears behind me and to just look forward to the future. So I did fine.
I was very scared at first. Speaking to the cardiologist, she felt that I needed a transplant because I had pulmonary hypertension also. So it was really scary, and I wasn't sure, did I really want to do this? But if I wanted to live a little longer, I knew that I would have to do that. What helped me make up my mind in particular was I was taking courses, continuing education courses, so that I could renew my nursing license. And there was a course on lung transplant. And I read that, or did that that little module, and that convinced me that I should do it. And then reading about pulmonary hypertension also.
I was kind of on the fence about getting a transplant. I went through all of the procedures and everything you have to do beforehand once, and then my mom ended up getting diagnosed with pancreatic cancer, and so I went home to take care of her, and I kind of lapsed that year because you're supposed to get everything done in a year, and then they kind of decide if you're getting put on the list. So the year lapsed. I went and took care of my mom, and then going through that and seeing, all the pain, emotional pain that my family was going through, and then she was supposed to be my caretaker as well at the time. So when she actually ended up passing away on March 11th of 2011, and so that was about 5 months, exactly 5 months from when I had ended up getting my transplant. So watching her pass and seeing the emotional pain my sisters were going through and my brother, I was like, I have to take care of me now. I can't put them through that again. And so I went and did all the testing again, and I went through it pretty quickly. I got listed, and I felt emotionally ready because of seeing all of that. And just wanting to be there for my family. So I think going through all that emotional stuff with my mom really helped just kind of clarify that I needed to take care of myself now.
The way I emotionally accepted the need for transplant was the realization that there were no other alternatives. And the way I made up my mind is I really just gave it up to God and knew that one way or the other, I would be fine.
I was a stubborn transplant recipient. At the time I was being evaluated for transplant, I was still working 30 hours a week. I was slower and less energetic, but I was doing fine, I thought. And I saw no reason for transplant at that point. And the 5-year, 50% survival rate really didn't bode well for me. But in a conversation with Dr. Hayes, he used that very statistic to change my mind. He said, well, how do you feel now? How did you feel 5 years ago? Because I'd been sick for 8 years with pulmonary hypertension. How did you feel 5 years ago? How do you feel now? And extrapolate and figure out how you think you're going to feel 5 years from now. And I thought about that, and I thought, oh, well, that's a very different way of thinking about things. And I think it was that day that I said yes to the transplant list.
The decision to get a transplant was pretty difficult to me to start with. I kind of fought the ideal of a transplant, feeling like I could work through it myself. And then the problems I had began to grow and got worse and worse. And when I got to the point that I really couldn't walk anywhere without, having to stop and on full oxygen, I realized it's time to either do that or I won't get anything done.
Emotionally, I accepted my transplant fairly easily, but I had a unique situation that I got sick fairly quickly. So I didn't have much of a choice, and I'd been so ill at the point up to that it was kind of a necessary thing. So it was just to accept it and move on.